Coronary heart disease interview questions with Dr. Martin Feigenbaum. My first question I have to ask you is, what is coronary heart disease?
That's a good question. Coronary arteries are the blood vessels that supply the blood and oxygen to the heart. So coronary artery disease is disease of those blood vessels that go to the heart. Now there actually are two main blood vessels that go to the heart, and they're called the left and right coronary arteries. As it turns out, the left coronary artery, when it gets shortly into the heart muscle, it actually divides into two blood vessels. And without getting too technical, we call them the left anterior descending coronary artery and the left circumflex artery. The right coronary artery is the second major blood vessel that goes to the heart. But for the purposes of considering coronary artery disease, we consider that three blood vessels because of the way that the left coronary artery divides when it gets into the heart muscle. So we frequently talk of three-vessel disease when in fact there actually are only two coronary arteries. But the disease of the coronary arteries is what causes what people call heart disease, heart attack. Refers to a decrease in blood and oxygen to the heart muscle.
My next question that I have for you is, what symptoms would a patient with this disease experience?
Well, that's a good question. And the symptoms may be multiple, meaning that it's not just one type of symptom that a person might have when they have heart attacks. A heart attack is the commonly used term referring to the fact that somebody's getting the decrease in blood and oxygen to the heart muscle of such a degree that it may cause death of heart muscle tissue. Not necessarily death of the patient, although heart disease is the largest single cause of death in the United States at the present time, and still is, although we've been having a decrease in the number of cases over the last decade. So, back to the symptoms. Most frequent symptom that people associate with the potential of heart attacks is pain in the chest. And a lot of people describe it as pressure or tightness in the chest. Some folks refer to it as like a belt tightening around the chest. I've even heard the term like an elephant sitting on my chest. But chest pain is only one of the symptoms. Sometimes people can get pain radiating, meaning moving up towards the jaw, to the back of the neck, to the area between the shoulder blades, under the arms, and or down one or the other of the arms. So chest pain is probably the most frequent symptom that people associate with heart attacks, which is the most common and serious manifestation of heart disease, coronary artery disease. Now, other symptoms can be shortness of breath, which is what we call a coronary or anginal equivalent, meaning some people don't get chest pain, they just get shortness of breath. Other people may get a feeling of nausea and or vomiting, and some people get tingling or discomfort in their arms. Those are probably the most common symptoms, with chest pain being the most common of the symptoms of coronary artery disease or heart attacks.
How is coronary artery disease treated?
Well, if someone is having a heart attack, for example, you'd want to have them get to the hospital as quickly as possible. And you'd want to have them evaluated thoroughly in as short a time as possible in order to see if something can be done to decrease the lasting effects of a heart attack. So when someone goes to a hospital emergency room, and if someone is having chest pain, they should be actually contacting 911 or someone in the family contacting 911 to get them to the hospital as quickly as possible. Treatment involves certain medications in anticipation that it might be a heart attack. For example, aspirin, taking nitroglycerin under the tongue if that's available. And when they get to the emergency room, various blood studies and an EKG, an electrocardiogram, which is a test of the heart's beating, basically, and its electrical conduction. It gives us an idea of whether or not somebody might be having a heart attack. But if it's determined that someone has a heart attack, then what's generally done, if the facility is available, is to take that person to a cardiac catheterization laboratory. A cardiac catheterization laboratory is an X-ray laboratory on the hospital facility, in which a catheter is inserted, usually into a artery in the groin area, threaded up towards the heart, and threaded into the blood vessels feeding the heart muscle to determine whether there's a blockage. If there is a blockage, then a chemical can be introduced, a balloon can be introduced, a stent can be placed. Different measures can be taken in order to try to dilate that blood vessel up from the blockage and decrease the risk of that blockage causing further death of the heart tissue.
My final question for you is, do you know anyone close to you that has experienced coronary artery disease?
Well, unfortunately, yes. My father's family had a strong history of coronary artery disease, and my father died of a heart attack. So yes, I'm very familiar with that.
Thank you.
You're welcome.